If it pleases you, Mr. Speaker, I congratulate the Honorable Minister of Finance for this expertly crafted document, the budget of 2016, stimulating growth and restoring confidence. The Honorable Minister informed us that prioritizing the investment in health is a key input towards achieving human resource productivity. Mr. Speaker, in order to ensure that all Guyanese enjoy the good life that beckons, strategic investment will be made by this government in the health sector on the implementation of a comprehensive review of the National Health Strategy. Contrary to what was implied by the Honorable Dr. Ramsaran, this National Health Strategy is not a PPP document. The Honorable Minister spoke as though it was formulated in Freedom House. Mr. Speaker, the National Health Strategy came into being by the direct inputs of the very directors that are at present working at the Public Health Ministry, with the contributions from the guidance from international agencies like PAHO WHO. This coalition government reviewed that strategy at a retreat we had in August of last year. And among others, we decided to place emphasis on the following: that healthcare workers should bear uppermost in their minds that the health of a nation is the wealth of the nation. The Ministry of Public Health paradigm shift to focus on primary health care. Mr. Speaker, this was in the budget of in the manifesto of the coalition, the emphasis on primary health care. And one can understand that if it's there in our budget, the emphasis on primary health care, the stand we took with regards that if we had a choice, what we would take when we take the specialty hospital into consideration, and what would have been our policy position with regards to that. It is found that we will promote greater integration of services, including health surveillance, especially in the remote locations of Guyana, with a focus on preventative rather than curative medicine. Thus, the name change of this ministry. We will also be addressing chronic diseases, the health of children and lactating and pregnant mothers, that we would use to emphasize health statistics information should be used in employing an evidence-based approach in the delivery of health services. We place emphasis on the fact that the Ministry of Public Health is adopting a multi-sectorial approach to healthcare delivery. And I think this was suggested by another member on the opposite side, an honorable member. But we have already embarked on engaging other ministries in our fight against diseases like Zika and causes of suicide. We have invited, that is the Ministry of Public Health, other ministries, and we engage other ministries like that of education, agriculture, citizenship, telecommunications and tourism, communities, natural resources, social protection, even public security, because they need to come on board so we have a collective approach in something as national as what is taking place now with respect to Zika. This is to ensure that the people of Guyana will be among the healthiest people in the Caribbean and across the Americas, and to ensure that they enjoy a good life. Mr. Speaker, the Honorable Dr. Mahadio, my good friend and colleague, sounded sharp in his presentation. He was congratulated by the Honorable Mr. Shearer, his chief whip. I think he might have been at his best. But I don't know if it was because he was quoting me so, lavishly. But, I must repeat some of the quotations that he used. He says that in one of my speech, I said the fish rots from its head downwards. Nothing but the truth. It is a fact, Mr. Speaker, that at times when the fish start rotting from the head, we try to correct that situation by taking off the fish head. And that is why at one time in the PVPC government, the Ministry of Public Health was without a head. Yes. Because the Minister of Health then was made unavailable. I don't know for what reason. Huh? Perhaps some of us know. But, Mr. Speaker, this did not help the rot because it had already gotten to the body. And then the Guyanese people took over because they threw out the entire fish. And then they began cleaning up and building recreational parks. And we ended up with a growing and greening economy in Guyana. But the Honorable Dr. Mahadio didn't stop there. That's why I said he went on quoting me. Liberally. Yeah. And he spoke about something is rotten in the state of Denmark with respect to the Shilindra Engineering Inc. and the specialty hospital. Shilindra definitely the one from India, not from Denmark, but something was rotten. This is a company with a track record in Guyana that had some difficulties with supplying the government with some drainage pumps. And I don't know if they have complied with that contract. But also with the Enmore sugar packaging plant. We run into difficulties there. And the PVP, true to form, awarded the contract to Shilindra Engineering Corporation to build the specialty hospital, and they never built any hospital in their life.
What?
So, fortunately, for having said that, I imagine, because shortly after what happened, the PPPC government fired Shilindra Company like they did for fraud. Okay? So something definitely was rotten in the state of Denmark. Mr. Speaker, this Ministry of Public Health has 7 programs and over 22.1 billion or 9.5% of the budget was expended in this sector in 2015. This year, we will spend about $28 billion, nearly $6 billion more than last year, or almost 11% of the budget. Of the 7 programs, we have the first program of governance and general administration. This program is critical to the smooth implementation of the ministry's mandate, especially with respect to human resources and communication, and particularly in the procurement and supply chain management. We as a nation must become more responsible for managing our own health outcomes. And it is for this reason that this government invests this large sum of money in drugs, medical supplies, equipment, and facilities to meet the growing demand for services in this sector. This coalition government has encountered many challenges and constraints in this sector. The reason for a total of nearly 1.2 billion being allotted to this sector, to this program. The over 57.2 million that is being earmarked as capital expenditure will correct the limited spaces which is inhibiting the ministry from functioning effectively. Mr. Speaker, this ministry lost 2 of its main buildings to fire. And since July of 2009, the PPP government had subjected the personnel of this ministry to work in spaces of limited capacity. All efforts will be made by this government to correct this situation. $20 million is earmarked for buildings which include remodeling and equipping the head office building for the minister within the ministry, so that the Honorable Minister Cummings can show us her motion without limitation. And let me tell you, Mr. Speaker, this minister will not be doing a tra-la-la-la. She will do something more appropriate, like, don't hold me back. Because she'll be ready to go. And her motion would be something like 6:30. Also, Mr. Speaker, $50 million has been allotted to upgrading of the electrical system for Food and Drugs Department, where more than $10 million would be used to acquire a mercury analyzer and an atomic absorption spectrophotometer. $10 million is earmarked for equipment in this program that includes a walk-in freezer and pallet trucks for the materials management unit at Diamond. Apparently, $1.1 billion was allotted at current expenditure for this program because of a dire shortage of human resources, which this present government inherited. These human resources are very much needed for the successful implementation of this healthcare vision. Strategies are devised not only to attract but to retain staff within the ministry, including the improvement of terms and conditions of employment. Relevant training are being done to build the capacity of personnel required to implement this strategy, especially within the Food and Nutrition Department. Mr. Speaker, 11 training programs for the Food and Nutrition Department was done from May to December of last year. And for this year, 21 more are planned, with the inputs from UNICEF and from PAHO WHO. All critical vacancies within this ministry are being addressed, and every effort will be made to fill the positions of the Deputy Chief Medical Officer, a position, Mr. Speaker, that is vacant since 1994, as well as the Director of the National Public Health Reference Lab, vacant since 2014. We have already filled the position of the Director of Regional Health Services with a qualified and experienced officer. This government, when we took up office, encountered this very important Ministry of Public Health with inconsistent access to information technology resources, which hinders greatly the collection of information, data management, and sharing of information. Mr. Speaker, every effort is being made to correct this situation by filling the vacancies that exist in this particular department, which from a staff of 17 persons, the department was formed by this government when it took office with only 2 such persons. The regional and clinical services of Program 4 will ensure that consistent and adequate quality health care is provided to all citizens across the 10 administrative regions based on the strong values of equity, solidarity, and quality health services as a human right. A total of approximately $13.3 billion was allotted to this program, of which 11.9 billion is going to current expenditure. We will empower the regions through training and increased human resources so that this ministry can be successful in its plan to decentralize the regional system. A standard complement of staff for each region is being put in place to avoid the multitasking of the few existing staff who in the past under the PPP regime have been called upon to function in discipline outside of their mandate. This must become something of the past. This coalition government continued to deploy medical doctors and other health personnel to hinterland regions. And note carefully, we refer to it as the hinterland regions. A past minister used to call it the bush. Mr. Speaker, the hinterland regions, we plan already to put in place, we have a national plan that a medical physician would be placed in every health center across the country. In this program, 1.5 billion was also appropriated as capital expenditure, for we plan to complete all unfinished structures, such as the health center experiment that the honorable member across the floor just referred to. It is a fact, Mr. Speaker, that I went to receive the keys for that building because $32 million was spent for the construction of that building since 2013, and it is still unfurnished and unfinished. So I went to take it over so that this government will make certain that it is properly furnished and complete. Mr. Speaker, a similar situation exists at the health center of Yawung. If the Honorable Shadow Minister of Health, I presume, doesn't know where Yawung is, we can take him up to Region 8, just about, we used to call it Mountain Foot. But the problem about the health center at Yawung is that $29 million was spent on that health center and it's still not finished nor furnished. But it's not only health center, Mr. Speaker. We have a brand new X-ray machine at the Parika Health Center for 3 years and it hasn't been used. With a lab next door to it built and not furnished. We will make certain that we get it working. Mr. Speaker, if the honorable member says that the 3 years non-functioning of that X-ray unit is bad enough, Wakenham has got one for 10 years, not used and still on rock. Mr. Speaker, the honorable member spoke about the opening of the intensive care unit for the neonatal intensive care unit at the West Demerara Regional Hospital. When you visit this hospital, Mr. Speaker, there is a conspicuous, bold bronze plaque, and on it written, this unit was declared open by the Honorable Minister of Health, Dr. Barry Ramsaran. Never used. 6 complete incubators. Never used. We worked on it, we got it functioning, and today on Facebook you can see the photograph of the first baby. Forget about that, we don't have first baby there. A neonatal, a premature. So, it is not true to come to this house and say that we have a list of medication and we know that it is functioning. I've been there. Mr. Speaker, it is not only the neonatology unit that we have there, but We also have that unit surrounded by an unused space that we put into function. We have created or refurbished the ward that existed there, and now we have a conditioned, well-painted, a postnatal ward which can accommodate as much as 15 beds. But it is not only those 15 beds which will now be converted into postnatal wards. When we go further down, Mr. Speaker, you go into the Lenora Diagnostical Center. There you go and you find another maternal unit that is unused, and the beds are wholesome, and the boarding room is everything there, and it's not being used. Mr. Speaker, we have $40 million to put into function that unit again. When you talk to the midwives, they said, we used to deliver babies here. They have a gynecological specialist there, but it is totally non-functional. And then what happens? This is so because the doubling up of beds in the Georgetown Hospital has become the norm in the PPPC government. $30 million is also earmarked for renovation or refurbishing of the Diamond Diagnostical Center. And $15 million is earmarked for the construction of a solid waste furnace for the Linden Hospital complex. $20 million is earmarked for the refurbishing and upgrading of a section of the old Linden Hospital building to establish a consultation room, a 10-bed surgical ward, and patients' waiting room. That is what we're doing. But it's not only at Linden. In Kokwani as well, we have a $50 million for the extension and remodeling of that hospital to house an operating suite, rehabilitation unit, and a larger nurses' restroom. But we're going to add new health centers to other regions, like in Yakashiba in Region 2. You know where that is, Mrs. Vigo? Or Simone in Region 9. We are going to put health centers in there, and adequate housing facilities will be provided for the staff to be deployed in regions such as Region 3, Fort Island, or even in Region 9 in Sand Creek, to build medics' houses there. Mr. Speaker, for the first time, the first of many to come, $30 million has been allocated for the acquisition of a fully equipped state-of-the-art river ambulance. If we put that ambulance at Purico, we could go right up to Kurupung or right up to Mabaruma, wherever. No longer would we have patients would have to die because the weather is bad and planes can't dash them down to Georgetown. Mr. Speaker, contrary to the reports that are being peddled by the regional politicians in the media and also in this House about shortages of pharmaceuticals and medical supplies in the regions, our on-the-ground reports from our regional health officers, not regional chairmen, regional health officers, and from information gathered from our various health facilities that we have personally visited, there are pharmaceuticals and medical supplies in the region, albeit a few shortages here and there. In Region 3, Mr. Speaker, in the presence of the regional chairman who carried an article in the Guyana Times, he was confronted by the regional executive office and the regional health officers and said, why did you say that to the newspaper? We have the drugs here. You could not answer.
Politics. Propaganda.
In Region 6, the same thing happened. When I called up Region 6, they said we got all the drugs we asked for. Yet the regional chairman was saying that there's a shortage. Mr. Speaker, permit me to explain the process for the procurement of drugs and medical supplies, which the members of the opposition seem to have a difficulty of understanding, especially the honorable member who questioned the budget allocation for pharmaceuticals and medical supplies. This process remains substantially centralized, with the exception of minor purchases that includes small emergency supplies like with medical gases and snake bite kits. The allocations have been distributed across the regions as a first step in improving the program budgeting of health costs at the regional level. Program budgeting. Even as work is advancing on a costing exercise to determine the total cost of drugs expended in each region to address the disease profile of a particular region.
Honorable member, you have 5 minutes remaining.
Mr. Speaker, I move that the honorable member be given 5 more minutes as an extension to his allotted time.
I thank the honorable member. Honorable member, you will speak for a maximum of 35 minutes.
But he's doing well, so we can...
Mr. Speaker, the Honorable Mr. Hamilton, in his presentation, implied that there is a shortage of HIV test kits across the country, which is misleading, Mr. Speaker. For I can assure you that there are enough kits in this country at this moment to last Guyana for the rest of the year. The honorable member went on to state that this budget caters very little, if at all, for the disabled. This statement is furthest from the truth. Mr. Chairman, Mr. Speaker, this program of disability and rehabilitation attracted an appropriation of $347 million. Mr. Speaker, isn't this a substantial amount for any one program? But yet the honorable member is saying that practically there is nothing for disability in the budget. Out of the capital expenditure of $26.6 million, $9 million will be used for the purchases of a 30-seater minibus, $11.5 million for medical equipment, including ultrasound and shortwave diathermy, and another $5.7 million was earmarked for equipment, which includes $4 million for a generator set for the Cheshire home. Mr. Speaker, we are in the process of moving apace with the establishment of a training school for children, adolescents, and young adults with special education needs associated with disabilities. This is with the cooperation and technical assistance from an agreement among CARICOM and the government of Cuba and that of Guyana. This agreement will pave the way for an establishment of a training center at the cost of $30 million. The Georgetown Public Hospital Corporation. This hospital will do all that is necessary under this government to provide the best possible medical, nursing, and other appropriate care in an efficient and effective manner to all persons. Mr. Speaker, $7.8 billion was allotted to the Georgetown Public Hospital of the total expenditure. From $7.3 billion, which is allocated at a current expenditure, $3 billion is allocated for materials, equipment, pharmaceuticals, and medical supplies and other consumables. Monies are allotted for the expansion of the renal center. At present, the government spends approximately $11 million annually for dialysis, and this will serve to reduce that amount. We will continue with the expansion of the Industry Health Center and the rehabilitation of the Medical Science Library. Mr. Speaker, from a sum of $60 million, $30 million is appropriated for the construction of a facility to house this CT scan, as the honorable member over there did say. But let me say this, that 298 million is earmarked for the purchasing of medical equipment, including 160 million for a 64-slide CT scan. I got this in the budget. This, Mr. Speaker, is reflected in the budget. This is where I got it from. This CT scan will save Guyana approximately $60 million per year that the GPHC spent on a subsidized cost on CT scan. 20 million for an operating table, 50 million for an anesthetic machine, 21 million for an invasive and non-invasive ventilators, and approximately $36 million for neurosurgical equipment. Mr. Speaker, all of this is in the budget, the estimates.
You have 5 minutes more. Honorable member, you have 5 minutes remaining.
Mr. Speaker, before I close, I would like the honorable members of the opposition to please be advised that the government of Guyana has sought and received the technical assistance support of the International Development Bank, Inter-American Development Bank, in the amount of $350,000 US to the Ministry of Public Health to aid in addressing key challenges in reducing maternal, infant, and child mortality. Additionally, Mr. Speaker, the Ministry of Finance has requested the preparation of the following loan resources and technical assistance from the IDB. 1, loan resources in the amount of $5 million US to improve maternal, neonatal, child, and reproductive health services at the primary as well as the regional hospital level. And 2, technical support in the amount of $1 million US for the implementation of projects which will support the response to the suicide epidemic in Guyana. The Ministry of Finance is currently seeking to be a member country of the Islamic Development Bank. If Guyana's application is favorably considered, Guyana will have access to approximately $50 million US in development resources, of which $10 million is earmarked for the health sector. Mr. Speaker, the good life beckons, and it will come nearer if we collaborate and cooperate with each other, rather than oppose for oppose's sake. So, Mr. Speaker, I want to...
Honorable member, you have 3 minutes remaining.
I want to urge the honorable members of the opposition not to panic because of what the Honorable Dr. Frank Anthony has said about the AIDS is an epidemic in Guyana. Epidemic with what? Zika. One case has been laboratory diagnosed. That's what you go by. And we have been sending and receiving samples. What the honorable member should let this House know that since they were in government in the epidemic of chikungunya, offer were made to the government then to send a technician to be trained, and that opportunity was not grasped. We have already done that. So shortly that person will be coming back to Guyana, and we won't have to send them any longer. Because it's not that it can't be done in Guyana, that we don't have the personnel, but we have the equipment to do it. So it is not an epidemic in Guyana, and to say that is irresponsible. This can best be considered as mischief. With this, Mr. Speaker, I beg that this budget be supported by all in the House so that we can really start stimulating growth and restoring confidence. Thank you very much.
Yes.